Dear students, what happened to others, whether they are going to join or not? Okay, so we will wait for another few minutes. If they don't join, then we will start. Okay, R12, please check with your batch coordinator about your exam timing because as per my knowledge, it is in the morning. And I saw even in the Zoom, it is in the morning. So please check with Mrs. Smita about your exam timing and confirm it by today itself. Okay, so we will start the class. So almost more than 50% of the students have joined. So I don't want to make all of you wait. So first thing is like we will start with the balance one. Hello. Okay, so we will start with balance testing today. So as we know, we have four types of balance. One is static balance, dynamic balance, then anticipatory and reactive. So first, our balance assessment will go into this type. So they will be checking whether they have all these four types of balance. Then next level of testing, we have to check what factor is affected, whether the motor input is affected, whether the sensory uh, input is affected, or the sensory integration is affected, or the somatosensory is affected. So you need to know what are the factors that are affected in the balance. So there are like two levels of balance testing. First, you will test what type of balance is affected. Then you will be testing in that what factors are affected, because according to that only you will be able to design the exercise protocol. So first, test the static balance. You can make them to do any type of static position, maybe sitting. So in case if the person is not having the sitting balance, then you have to make them to sit in a chair and find out whether they are able to sit without any support. So you have to just make them to sit in a chair with both the legs together, supported on the chair, and the feet should be supporting the floor. Then ask them to just cross the hands. So ask them to sit in this manner. Check whether they have the sitting balance. So this one you have to check with eyes open for 30 seconds, then eyes closed for 30 seconds. So this is for sitting. Then if they are able to sit in the chair, then you can either increase the chair height or decrease the chair height, and you can also check whether they are able to sit in a stool, all those things. So this is for sitting balance testing. Then next is the standing. So standing already we know, like we can make them to stand in a normal standing position. Then you will make them to stand in a narrow standing position. So normal standing position is you need to make them to stand in 1 feet apart. 1 feet means like your shoulder width apart. The leg should be in such a way that it is shoulder width apart, and they have to stand with eyes open for 30 seconds, then eyes closed with 30 seconds. Okay, so this is for standing. Then standing balance. Along with that, we have something called Rombeck's test. So this Rombeck's test is ability to stand with the feet parallel and together with each other. Okay, so let me just show you with a video. Okay, so are you able to see the video? This is Rombert's test. Okay, so this is about Rombert's test. So you need to make sure whether the patient has any swaying. Swaying means they will just move forward and backward, or like whether they are removing their hands to for support or holding anything. So if they are able to stand for 30 seconds, then they are normal. So same thing you have to make them to do with eyes closed also. Okay, so this is Rombert's test. So this test is done to check the static standing balance. So if they are able to perform this, then what you can do is you have to make sure that they are keeping their legs forward just in front of the other leg. So that is called as sharp rhombex test. Okay. So with the same position, so this what I said like shoulder width position. If you see this width and the feet width, it will be together. Okay. So this is called as shoulder width. So Sharp rhombex is just take the leg and keep it in front of the other leg. Okay, so that is called as tandem standing, and the test is called as sharp rhombex test. So that also you will be performing for 30 seconds with eyes open and 30 seconds with eyes closed. So during their eyes open, if they don't have anything, any swaying movement, or if they're able to stand normally, but during their eyes closed, if they are having the swaying movement or if they are not able to balance themselves, that means the patient was depending on visual input. So once the visual input is cut off, they are not able to maintain the balance. So in the somatosensory integration, the patient was basically depending on visual input. Is that clear? So that is a difference to say with eyes open and eyes closed, and that is why we are testing in eyes open and eyes closed. Is that clear? So this is the second test. So first is rhombex and second is sharp rhombex. Then next is single leg balance test. So here again, in the same position, you need to ask the person to lift the leg forward and keep it keep it in such a way that it is not touching the floor. So you can in standing position with the feet apart, so with the feet apart. So in this position with the feet apart with the chest level, what you have to ask the person to do is lift the leg forward. So he can lift 90 degree flexion of hip and 90-degree flexion of knee. Okay, so he has to stand in that position and see you need to check whether he has any swaying movement or whether he is moving his body hand to hold something during that 30 seconds. So this also you need to do for eyes open 30 seconds and eyes closed 30 seconds. Okay, so this is single leg testing. So first your base of support is broader. Okay, in the single leg test, the base of support is less. So the challenges are increasing in the testing. So first you make sure you are able to do with broader base of support. Then you make sure whether he is able to do with narrow base of support. Then in single leg. So slowly you are reducing the base of support as well as you will be doing it in eyes open and eyes closed. Okay, so this is third test. Then the next one is stroke test. So this is you need to keep the leg like a you need to keep the leg like a stroke. So this is your 1 minute.
Start balance stand test. The purpose of this test is to measure the ability of a person to maintain body equilibrium. To do this, we need a flat, non-slip surface and a stopwatch. To do a start balance stand test, first, the performer need to remove the shoes. Stand straight and place hands on the hips. Position the right foot on the side of the left knee. Raise the left heel to balance on the ball of the foot. Maintain balance as long as possible. Do the same procedure with the opposite foot. For the partner or facilitator, start the time as the heel of the performer is raised off the floor. Stop the time if any of the following occurs. The hand come off the hips. The supporting foot swivel or move in any direction. The non-supporting foot lose contact with the knee. The heel of the supporting foot touches the floor. There shall be 3 trials. Scoring. Record the time taken on both feet in nearest seconds and divide the score to 2 to get the average percentage score.
So this is the scoring. Okay, so if the person is able to stand only this much, then the score is 1. Okay, so according to that, we have to give the interpretation. So here, like, yes, somebody has asked me a question. Yes, like you need to increase the complexity. So first, if you start with the static balance testing, you can start with sitting test. In the sitting test itself, you can increase the complexity, like first give them a back support chair, then slowly ask them to sit without back support. Then you can increase the height of the chair, then you can decrease the height of the chair, you can give a footstool, like that. So those are increasing the complexity. Then making them to stand, then from in standing you can increase decrease the base of support. So that these are the ways to increase the complexity and to find out whether they have the balance or not. So if they are able to have the balance for 30 seconds, it is more than enough. Okay, so if um uh, okay, so this balance they will be comparing with the fall rate. So the if they have more than 30 seconds, that means their falling rate will be very less. So that's what we check for 30 seconds, everything. So these are the tests for your static balance. Then for the dynamic balance, so the dynamic balance, we need to in any of the above position, you can make it like a transition from one position to other. So transition from one position to other means may ask the person to sit from sitting to standing, ask the person from standing to walking, ask the person to stand walking to stair climbing. So this is your transition from one position to other. So you can do this. Uh, then you this like when you are making them to sitting to standing, standing to walking, walking to stair climbing, all these you are performing in a you need to see in which platform you are performing, whether you are performing on a normal surface, or you're performing on a firm surface, or you're performing on a Swiss ball. So if you're performing on a normal surface, then that means the proprioception will be very good. When you're performing on a foam, then you will have little more complex. So that is increasing the complexity. Then when you are performing on a Swiss ball, this will be increasing the complexity furthermore. That is, the platform will be moving. So they are supposed to balance the moving platform as well as their body. So these are the slow increase in the complexity. First, make them to perform in a normal surface, that is stable surface, then slowly into the unstable surface, like a foam, cushion, then to a Swiss ball or a moving platform, something like that. Okay, so not only this, you can ask them to jump, hopping, skipping, marching. All these are like some of the dynamic tests. Then apart from that, we have another one test called sit to stand test. Okay, so the sit to stand test is, let me show you.
The four-stage balance test assesses static balance, which is an important part of postural stability. To perform the test, you only need a stopwatch. Tell your patient that you will show her 4 positions and would like her to try and stand in each position for 10 seconds. She can hold her arms out or move her body to keep her balance, but should not move her feet. For each position, describe and demonstrate it, and then stand next to her and hold her arm if needed to help her assume the correct foot position. When your patient is steady, you can let go. Say ready, begin, and begin timing. But you should stand close enough so that you can catch her if she loses her balance. After 10 seconds, say stop and record the time she was able to hold the position. If a patient can hold a position for 10 seconds without moving their feet or needing support, go on to the next position. If not, stop the test at this point. For the first position, the patient should stand with her feet side by side. For the second position, she should place one foot so it is touching the instep of the other foot. For the third position, she should place the heel of one foot in front of the other foot, touching the big toe. For the fourth and last position, have the patient stand on one foot. An older adult who cannot hold the tandem stance or either of the 2 prior stances for at least 10 seconds each is at increased risk of falling. Thank you for taking the time.
Okay, so this is static test. Okay.
Functional lower body strength. To administer this test, you'll need a chair with a straight back and a stopwatch. Place the rear legs of the chair against a wall so that it cannot slide backwards. Have your patient sit towards the front of the chair and fold her arms across her chest. Ask her to keep her feet flat on the floor and sit upright. She should try to stand up, keeping her arms folded across her chest without pushing off with her arms. When you say go, she should stand up all the way and then sit back down, doing this as quickly as she can until you say stop. Arms should remain folded across her chest throughout the test. Stand close enough so that you can catch the patient if she loses her balance. If the patient gets tired, she may rest, but let the time keep going. If she cannot stand even once, the test score is 0. Not being able to stand up from a chair without using one's arms to push up indicates a high risk for falls. Record the number of times the patient stood up in 30 seconds. If the patient is over halfway to a standing position at the end of 30 seconds, count it as a stand. Now, based on the age and sex of your patient, find their normal range on this chart. If your patient's score is below the norm for his or her age and gender, it indicates lower body weakness, a risk factor for falling. If the patient can't stand up even once without using her hands, allow her to push off using a hand on the chair. Be sure to document any adaptations. The test score is still 0 for purposes of comparing to normative standards, but this way her personal performance can be evaluated from one assessment to the next. I find this test is very helpful for monitoring the effects of strength training. It's also useful for motivating patients because they can see how much they improve by doing strengthening exercises on a regular basis.
Okay, so this is one way of doing the sit to stand test. Another way is you check the timing they have taken to do 5 times. Okay, so either you can decide the timing to 30 seconds and ask them to do the test, perform the test and see how many times they are able to do sit to stand, or else you make them to do 5 times sit to stand and check their timing. So if their timing is less than 15 seconds or 5 times, then that means like they are very, very stable. If their timing is like more than 15, that means they are having a risk of fall. Okay, so this is the sit to stand test. So these two are done to check the dynamic balance. Okay, so another thing is like you can design your own testing depending on this particular depending on all these factors. Is that clear? So next we will go to the anticipatory posture checking. So here, anticipatory posture control testers. So you will be explaining them that during any of the position, like in standing or in sitting, you will be asking them to throw a ball, catch the ball, and you can ask them to hold anything, open the door, close the door, or lift any object in any of the static position. So, like in any of the static sitting or standing position, you can ask them to do any of activities with anticipatory. With anticipatory means before itself you will tell them that you are going to throw a ball. Before itself you will tell them that you are going to open the door. So that is called as anticipatory posture control test. So if they are able to perform, then without any losing the balance, then that means they have the anticipatory posture control. If they are not able to perform, that means they don't have. Okay, so we can also do this with other tests that is called as functional reach test. And this functional reach test can be done in single direction or can be done in multiple direction. Okay, so here what you do was, so you ask a person to stand near a wall and extend and flex the shoulder to 90 degrees. Then ask the person to reach how much ever possible. Okay, so you can check the measurement. They are able to reach a particular point without changing the base of support. Okay, I'll show you the video of that.
Functional Reach Test. Functional Reach Test is an objective measurement tool of dynamic balance. The purpose of this test is to determine a person's ability while the participant reaches forward. How to set up the test? Place a 1 meter long ruler or a measuring tape on the wall next to the start line. It should be approximately 1.2 to 1.3 meters above the ground in order to be in line with the average shoulder height. This is how the test should look like. Before the test begins, the physiotherapist demonstrates how the test is done. Ask the participant whether they understand the instructions before starting the test. Remember, the demonstration to the participant should be clear. During the implementation of the test, the participant should be asked to 1. Stand next to but not touch the wall, and 2. Position his right or left arm that is closer to the wall at 90 degrees of shoulder flexion with a closed fist. There are a few things you should take note of. The participant's feet should be positioned shoulder width apart. Shoes can be worn during the test. However, if the footwear may cause the participant to lose balance, remove their socks and shoes. The participant's shoulders should be in line with their hip and foot. Arm must be raised perpendicular to their body. Outstretched hand must remain in a fisted position, and the participant must not lean against the wall at any time during the test. Once the participant is ready, instruct them to reach forward as far as they can with their fist without taking a step. To get the accurate measurement, first measure the participant's starting position on the ruler from the knuckle of their third finger. Once the participant is stable after reaching forward, Measure the end position on the ruler from the knuckle of the third finger. Participant should be given 2 tries and the best result will be recorded. The don'ts: do not lean against the wall. Anytime the participant loses their balance during the test, stop the test. Summary: remember that the demonstration to the participant should be clear. Shoes can be worn. However, if it is inappropriate, remove shoes and socks. The participant's feet should be positioned shoulder width apart. Arm must be raised perpendicular to their body. Outstretched hand must remain in a fisted position. Do not lean against the wall. Stop the test if anytime the participant loses their balance during the test.
Okay, so one more video on balance testing, like same functional reach.
Assalamualaikum warahmatullahi.
Today I will be discussing the functional reach test and modified functional reach test. The functional reach test and modified functional reach test can be used with anyone over 18 years old and is typically used with individuals who have Parkinson's, an SCI, a CVA, vestibular disorders, or with older adults and geriatric care. It assesses balance, functional mobility, and vestibular capabilities. It is an observational assessment and usually only takes about 5 minutes to complete. It falls under the ICF category of activity and does not require any specific training in order to be administered. The equipment needed for the functional reach test is a yardstick or meter stick and a form of adhesive, like tape or Velcro, in order to attach the yardstick to the wall. If the modified functional reach test is being administered, a chair is also necessary. It should be noted that in this scenario, I did not use a yardstick, but instead marked the reach lengths on tape and measured them afterward. These are the instructions for administering the functional reach test.
Hi Liz! So today we are going to be doing the functional reach test. So you are standing perfectly. Just make sure you don't touch the wall. What I'm going to have you do is put your arm at 90 degrees with your hand in a fist. Perfect. And then I'm just going to line you up at the end of our measurement. Perfect. And you need to take something. Yeah, that's awesome. Okay. So what I'm going to have you do is we're going to do this 3 times. The first time just be a trial run. I'm going to have you reach forward as far as you can. You can bend if you need to, but just make sure that you don't take a step, okay? So we'll measure your first trial. Go ahead for me. Okay. Okay, one more time. Okay, and then your fist back up. And last time. Okay, perfect. Thank you so much.
These are the instructions for the modified functional reach test. The modified functional reach test is used for those who are unable to stand and is performed while sitting in a chair. It includes 3 separate reaches, one central or forward reach, a right lateral reach, and a left lateral reach. If the client is unable to raise one of their arms, the distance covered by the acromion when leaning forward will be the recorded measurement.
Okay, Liz, so now you're going to work on the modified functional reach test. So it's pretty similar to the functional reach test that we did, except you are sitting, and there'll be 2 other portions that we'll be working on after this first part. So the first part is very similar to the functional reach test. I'm just going to have you sit with your feet flat on the ground. They should be 90 degrees to your leg, and then your knees should be 90 degrees, and then your back should be at 90 degrees with the rest of your body, with your back up against the back of the chair. Perfect. So go ahead and put your arm out at 90 degrees with your hand in a fist. Awesome. And let's see. Okay. So make sure you don't touch the wall. and then I'm going to have you reach as far forward as you can, and then I'll take a mark, and that'll be our trial, and then we'll do it 2 times after that. Okay, so go ahead and reach. Okay. And whenever you're ready, you can reach again. Okay, and then last time. Okay, thank you very much. So this is the second part of the modified functional reach test. So now your back is against the wall. You're going to put your right arm out at 90 degrees with your hand in the fist. I'll line it up with the edge right here. Awesome. And then you're going to reach, instead of you were reaching forward before, you're going to reach to the side as far as you can. Okay, and then same thing as before, we'll have the trial and then the 2 other reaches, okay? So go ahead with your trial. Thank you. Okay, whenever you're ready, you can go ahead and do the second reach. Okay, and then your last reach. Okay, perfect, thank you. Okay, so now we're on the last part of the modified functional reach test. It's going to be exactly the same as when you reach with your right arm, except now you're doing it with your left arm. We'll have the 1 trial reach and then the 2 reaches afterwards, okay? So go ahead and, okay, so this will be your trial reach. Go ahead and reach as far as you can. Okay, and then reach number 2 whenever you're ready. And then last reach for me. Perfect. Thank you. You're welcome.
This is Liz's
Okay, so this is what functional reach test. Then like when you are doing this in a multiple direction, then we say it is a more multiple directional test. So you can do in forward position, you can do backward, you can also do in the sideward positions. Okay, like side positions or anterior, any direction you will be able to do it. So this is your functional reach test. Next is star exertion balance test. So this is to check whether the lower extremity has a limitation. Okay, so they will be asking the person to do the movements in 8 different directions. Okay, so let me share the video, 1 minute.
G'day guys, I'm Matt from thesportsphysiotherapist.com. Thanks for being here and welcome to our very first video of our online series. Today, as promised, I'm discussing my very favourite dynamic postural control objective outcome measure, the STAR Excursion Balance Test. It's my favourite for 4 main reasons. It's easy, it's reliable, it's clinically relevant to my athletic population, and it's clinically useful. All you'll need are 3 bits of tape put on the floor, a tape measure to measure the distances, and a pencil to mark it. Couldn't be easier than that. So the tape is set up in the way shown here. The anterior piece is the midline, then you have the 2 posterior lines, which are at a 45-degree angle to the anterior piece. It is strongly recommended that you have a standardised assessment. To account for the learning curve, the athlete is allowed 6 practices. You then have 3 test attempts, of which you take the best score. The athlete performs 3 attempts in the anterior direction, as seen here. 3 attempts in the posteromedial direction, as seen here. And then 3 attempts in the posterolateral direction. So an attempt is discarded if the athlete touches down with this reach leg, as seen here, or if the athlete fails to maintain unilateral stance, as seen beautifully here. So in terms of outcome assessment, there are 2 relevant scores. The first is the difference between anterior reaches, The second is the difference between composite or adding all three scores together. If you want to find out why they're important, visit thesportsphysiotherapist.com.
Okay, so this is about the anticipatory posture control test. So next is reactive. Sorry.
Now, a couple testing guidelines.
Okay. Next is reactive testing. So reactive testing is in the anticipatory, you explain them that this is going to happen, and you are going to do the movement or you are going to throw the ball, or you are going to react to the particular situation. But in the reactive, you are not going to tell them that this particular thing is going to happen. You just do the movement and see how their body is reacting to that particular situation. So this is called as reactive posture test. So the first test here is
push release test. We will be performing the test first, and then I will explain later. So please stand like this. I will be standing behind. You need now to lean backward with your weight, but make sure that both heels are on the ground. But I'm allowing him to put his weight on me, so that's why I'm flexing both my elbows, and I will suddenly release. As you can see, he was able to recover independently with even like a mini step backward. So from this test, he will record 0 because his balance was really good.
okay. So this is push and release test.
Usually, we don't explain this to the performer to assess because this is a reactive balance. So that's why I will not tell him in the first that I will be moving my hand. He didn't expect the response.
Okay, so this is reactive. So without telling the patient, you need to do the movement and see how they are reacting, how their body is reacting, and how they are able to maintain the posture. Okay. So apart from this push release test, we can also do the perturbation test. So perturbation test is you make the person to stand and give the small perturbation. That means small push, and see how they are reacting. So the body will be reacting by using the 5 different strategy. That is ankle strategy, weight shifting strategy, hip strategy, then stepping strategy, and combined strategy. So all these will be a suspension strategy. So the body will be reacting with any one of the strategies. So you can also do the small perturbation, a large perturbation, and we can also do this post release test. So there are few more tests in this. Next is this is full test. Okay.
The full test, now we will demonstrate how to perform the full test. It is one of the tests that can be used to assess reactive balance. You don't need any equipment. Simply, the therapist needs to go behind the performer, and both arms will be over the shoulder, and I need to apply a backward pull, but the performer doesn't know when, so that's why it is reactive. Okay. And simply the instruction would be you need to stay as stable as possible, and it's okay to take steps if you want to regain your balance. And I will suddenly pull the performer backward. Now he took one step, and there is a scoring system for the pull test, and for the scoring system, he was able to recover independently using only one step, and that's why he will score 0.
one more video about this. So I think that's all. So this is about the reactive postural control test. Okay, so next, once we are able to do this, if the person is able to do all these things, then we can go to the next one and see like how they are, uh, uh, what to say, like what are the other factors that are affected. So for that, we have many of the tests. So we will see one by one. First is bug balance scale test. So I think bug balance scale test will be a bigger one. So we will go with the Trinity test.
The time doesn't go. Or tug tests functional mobility. To perform the test, you need a chair and a stopwatch, or a wristwatch with a second hand. Have your patient start by sitting on the chair, feet flat on the floor, one foot slightly in front of the other, and hands on the armrests of the chair. Put a line on the floor 10 feet or 3 meters away. Ask your patient to stand up from the chair and walk at her normal pace to the line on the floor when you say go. When she reaches the line, she should turn around, walk back to the chair, and sit down. Be sure to start timing on the signal go, and even if your patient has not started to move, and stop timing at the moment she sits back down in the chair. While she's walking, stand between the chair and the line in case the patient loses her balance and you need to assist. Observe and note the patient's posture, width of the base of support, step height, stride length, arm swing, and path. When the test is complete, record the time. Also record whether the patient used an assistive device, and if so, what type. A community-dwelling older adult who takes more than 12 seconds to complete the tug is at increased risk of falling.
Okay, so don't worry, I will finish off before 1 o'clock. Okay, so we will see one more test because there are nearly 10 different tests that we are supposed to see. So we will see one more and we will stop the class. Okay, next is Trinity Perform test.
If you're an eye health professional in a low-resource country, it can be difficult to access the training and
Hello, my name is Robert Harrison. I'm a student physical therapist here at Trine University. Today, I'll be demonstrating the Tenetti Performance Oriented Mobility Assessment, or Tenetti POMA. The purpose of this assessment is to measure an older adult's gait and balance abilities. The normative data for this assessment lists older adults as 65 years of age or above. The Tenetti POMA was designed to measure balance and gait function in elderly, but also has been used in patients with various conditions, such as those with Parkinson's or who have had a stroke. The assessment tool is measured on a 3-point ordinal scale, ranging from 0 to 2, where 2 represents independence and 0 represents the most impairment. The scores are then combined to form 3 different measures: an overall gait assessment score, an overall balance score, and a combined gait and balance score. The maximum score for the gait component is 12 points. The maximum score for the balance component is 16 points, creating a total max combined score of 28 points. In general, patients who score below 19 are at a high risk for falls, and patients who score between 19 to 24 indicate an increased risk for falls. The equipment needed for this assessment includes a chair, something to keep time, and a 15-minute walkway. So let's get started. So, this is Kristen. She's 68 years old. She recently had total knee arthroplasty on her right side, and she's been working on increasing strength and endurance in the clinic to improve her gait and her balance. So we're going to administer the Tenetti Poma to screen for impairments if there are any. So the first part of the assessment is balance. I'll have her just sit back in a chair like she would normally, and just kind of make note of her posture, if she's swaying, if she's leaning to one side. Kristen is sitting steady and safe in the chair, so she receives a 1 for sitting balance. I'll ask her to stand. When standing, we look at 4 things: arise, attempts to arise, immediate standing balance in the first 5 seconds, and standing balance after 5 seconds. Let's see what Kristen does here. Kristen was able to stand, but used her arms to help get up, giving her a 1. She arose from the chair the first try, so she'll receive a 2. Immediately after standing, she was steady without support or use of an assistive device. 2. Lastly, she stands with a narrow stance, again without support, giving her a 2. And then what I'm going to do is I'm going to nudge her with my open palm on the sternum 3 times. Here we see Kristen stagger during a nudge, which puts her at a 1 for this task. Then I'll ask her to put her feet together. And then go ahead and close your eyes. And go ahead and open them.
Can you see this? This is called swaying. Okay, so once you close your eyes, sometimes most of the people will be having this swaying. So this means the persons were relying mainly on the visual feedback for the balance. So once the visual feedback is stopped, they are not able to balance properly, or they are able to balance, but they have little disturbance.
Now what I have you do is a 360-degree turn. So just turn all the way around as safely as possible. Okay, and then I'll just have you have a seat in the chair. Awesome. For number 7, Kristen remained steady when standing with eyes closed. However, she had discontinuous steps and was unsteady when turning 360 degrees. Lastly, upon sitting, she used her arms to lower herself, bringing her total balance score to 11 out of 16. Now we will move on to the gait assessment portion of the Tenetti, which includes 7 different tasks: initiation of gait, step length and height, step symmetry, step continuity, path, trunk, and walking stance. So the next part of the Tenetti Poma is gait analysis. What I'll have the patient do is walk 15 feet down at a normal speed and then back at a quicker pace. And I'll explain that first. So what I'll have you do is go ahead and stand up. And then when I say go, I want you to walk down to the edge of this darkened tile here, turn around, and then walk as quickly and safely as you can. Ready? Go. In the clinic, it is a good idea to have the patient do the 15-foot walk more than once if time permits, so that you can be certain of any gait abnormalities. In this instance, Kristen did not hesitate after being told to go. Her feet cleared the floor, but the shortened stride length decreased the amount of swing in her gait pattern. Her step lengths were not equal, and she discontinued them during a portion of the walk. She deviated when returning at a quicker pace and had a noticeable arm and trunk sway when walking. Lastly, her heels were in the appropriate place and not too far apart when walking. Because of all this, Kristen scored a 5 out of 12 for the gait portion of the test. Now it is time to analyze and interpret the results to the patient. Your gait score was a 5, your balance was an 11, and just what we do is we'll add those both together, and you got a 16. Now anything below 19 indicates a high risk for falls. So that's just something that we're going to want to keep an eye on. Just be aware of your limitations and strengthen that way.
Okay. Sounds good.
Okay. So, sorry. So, like, it doesn't mean that you need to perform all the tests for all the people. So when you are performing the static test itself, like you can static and when you are performing the first 4 itself, you can decide what are the other tests you want to add up. So like nearly, if you see, we have around 20 tests for the balance, but it doesn't mean that you have to follow or you have to make them to do all the 20 tests. So you can choose the test according to the patient's need. Is that clear? So remaining tests we will try to complete by next class. So please let me know if you are free tomorrow 3 to 4. Okay, so according to master timetable, it is free, but if you don't have any classes or exams, then you just let me know. Is that clear? So I'm very sorry for what happened today. I had the old timetable on my table, so I just was thinking that 2 o'clock is the class. So I just went to the meeting without informing you. Okay, so I'm very sorry. Okay, thank you all for coming to the class in a very quick information. Thank you. Have a good lunch.